Hi, I'm Neil O'Grady, osteopath, and now I'm continuing on from part one of our video on the brachial plexus. If you haven't seen part one, I suggest you do, because this may not make any sense without viewing first part one, which will take you all the way from where the brachial plexus leaves the neck, where it navigates its way under the collarbone and over the first and second rib, under the pec minor, and where it will feed the cutaneous nerve supply and motor nerve supply of the entire shoulder girdle and arm. Okay, so no, from there we have gone all the way to the terminal branches. So if you remember that, remember to drink cold beer. It was roots, trunks, cords, divisions, and branches. Okay, so we've gone all the way over, and then what we did was we terminated in here at the musculocutaneous branches. So the rest of it was over here, and these were the terminal branches, which were down in the axilla. So it was where the brachial plexus we had stopped kind of here, and we had these, and it was marmu, if you remember correctly. So it was musculocutaneous, axillary, radial, median, and ulnar nerves. Now these ones feed a lot of muscles in both cutaneous nerve supply and motor nerve supply. So I'm going to go through both the cutaneous and motor nerve supply for all of these. So stick with it. I'm going to try and keep it certainly under 20 minutes. And so between part one and two, you can look over the videos again, pause them, rewind them, and look over them. And you should have a pretty good understanding of the brachial plexus by both videos. Okay, so we'll start with musculocutaneous. We'll go black here, okay? So we're going cutaneous, okay? So the cutaneous nerve supply to this, and it will be the lateral side of the forearm. That's it, okay? And the motor for this will be three muscles, and the three muscles that will be supplied by the musculocutaneous nerve in terms of motor function will be the coracobrachialis, the brachialis, and the biceps brachii. So excuse me if I spell this wrong, brachialis, okay, the brachialis, and the biceps brachii. Okay, so let's wrap this up in a square or in a rectangle like that. So, okay, and talk about the three muscles. The coracobrachialis. So firstly, it innervates the coracobrachialis. That is a small tubular muscle that goes from your coracoid process, and it comes down like this, moving laterally onto the mid shaft of your humeral bone. And what it does broadly is it extends the shoulder joint, the glenohumeral joint, like that. So it's an extension like that, and it will also deduct the shoulder like that, the glenohumeral joint like that. Okay, so that's what the coracobrachialis does. The brachialis joins on the mid to lower part of the humerus here and crosses the joint, and the brachialis is behind the biceps brachii, so everyone knows your biceps brachii, and that's job is elbow flexion, okay, purely elbow flexion. And the biceps brachii, so it's biceps, we notice two heads, a long and a short, and the biceps brachii crosses both the elbow joint and the shoulder joint. So it goes from the bicipital aponeurosis here on the lower arm, in here like that, and it crosses the elbow joint, and there's got a long and a short head. The long head will come up through the bicipital groove here in the shoulder. It'll go over the glenohumeral head and it'll attach to the scapula. It's called a supraglenoid tubercle, I think, here, and the short head will go across to where the coracoid process is. So that's the biceps brachii. Its role is elbow flexion, okay, and supination. So this is supination. So I remember supination as like soup, like a soup bowl. So when you supinate, you're creating like this soup bowl scenario here. And it's also involved in some flexion of the glenohumeral joint because it crosses the joint up here. So it's like this kind of motion here, elbow or shoulder flexion. So sometimes when you get a biceps tear, it can tear distally here and roll up this way. So you get this kind of Popeye thing going on. Or it can tear, you can get a proximal tear and it can tear off up here. So the long head of your biceps will tear and it will roll down here, which is not a nice injury, but it will roll down here. You'll have, often with that, you'll have what's called a positive speeds test, which is this test here. It's an orthopedic test for biceps, long head of the biceps, and you push down and you get soreness up here in the bicipital groove. Okay, so that's the musculocutaneous branch. Now we're going axillary. Let's change the colors up a little bit, okay? So that was the musculocutaneous. This is the axillary. And now we're going cutaneous, okay? This is an easy one, okay? And the cutaneous nerve supply from the axillary nerve is the posterior and lateral deltoid. So that's really all the nerve supply in terms of sensation. Posterior and lateral delt, okay? So I'm going to do a bit of shorthand here. Delt, and then motor. Okay, motor is going to be the deltoid muscle. Deltoid, and it's going to be the teres minor. So let's have a quick chat about those. Now, that's 2 of 5. We get into the ones with loads of muscles in a second. So the deltoid is here, as we know, and the deltoid, its main roles are flexion of the shoulder. So the anterior head will be strongly involved in flexion of the shoulder. The lateral head will be involved in abduction, like that, and the posterior head will be broadly involved in extension of the shoulder. And the teres minor is one of your rotator cuff muscles, and it's just below the infraspinatus, and it joins onto the inferior lateral part of your scapula, and it's broadly involved in external rotation of the shoulder. So that's the teres minor. And now we're on to the radial. This one's got loads of stuff going on, okay? So we go red. So cutaneous. Hope this is big enough. Again, I'm making it as big as I can on the board. Use a zoom if you want to see it more clearly, and I'll take a picture of it at the end, and I'll have that at the end so you can see the whole thing. So the cutaneous for the radial nerve is the posterior lateral aspect of the arm, upper limb, the tricep here, like that. Also the mid dorsum of your forearm here, like that, so down the center of your extensor compartment here. And it is the dorsum of the hand, so in an anatomical position like this, it will be the dorsum of the hand. So the 1, 2, 3 digits and half possibly of the 4th digit, this area of the hand here, like that, okay? And that is your cutaneous nerve supply of the radial nerve, okay? So we're going to say tricep, dorsum, middle, okay, forearm, and the lateral 2/3 of the hand, okay, dorsum, lateral, dorsal, lateral, dorsal, 2/3, hand. Okay, so that's the cutaneous aspect, and now we're on to motor. Now we're on to the motor aspect of the radial nerve. This is loads and loads of muscles. Okay, so I'll try and get them all. If I miss any, you can give out to me in the comments. Okay, so the motor branch supplies the triceps. It supplies the accredited, which is a smaller extensor, which I'll go into. It supplies the brachioradialis. It supplies the supinator and almost the entire extensor compartment, which are these ones here of the forearm. So, and it also supplies some of the intrinsic muscles in the thumb and finger as well, and the thumb here as well. So let's get into the motor branch. Let's start writing them down. So here we go. So the triceps, brachii, accredited, supinator, and I'll explain them in a moment, okay, what each one does. Supinator, and what did we say then? We said brachioradialis, and then we said all the extensors. So extensor carpi, radialis, longus, and brevis. And we said we're saying extensor digitorum, extensor digiti minimi, extensor indicis. So extensor indicis, extensor carpi ulnaris, abductor pollicis longus, and extensor pollicis longus and brevis. What a lot of muscles. Okay, that's a lot. Okay, that is a lot. Okay, let's divide that. Let's box that off there. Okay, and talk about those muscles. Okay, so triceps brachii is a extender of the elbow, and it's also involved a little bit in extension of the glenohumeral joint, because it's some of the long head attaches onto the scapula. The accredited is a smaller, lesser known muscle down here, which is just a pure elbow extensor. The supinator comes off the lateral supracondylar ridge of the humerus and wraps around the annular ligament of the radius and the radial distal or the proximal part of the radius, and it supinates. So this kind of supination motion. Brachioradialis, another interesting one. It's an elbow, it's an extensor, but also an elbow flexor. And you'll know this one will usually pop up if you put your hand under a tabletop like that and you push up like that. It's this one here that pops up when you do this. Okay, so that there is your brachioradialis. Extensor carpi radialis. It's longus and brevis. The longus comes down here onto the first carpal, and the brevis comes onto the second carpal here. So Susie longs, so scaphoid lunate, and it extends the wrist, and we'll also do a little bit of radial deviation like that. If you're in the anatomical position, you've got extensor digitorum, extends the digits. Extensor digiti minimi, your pinky, goes down onto your small finger here. Extensor indicis, okay, so it comes down, extends your index finger. It actually comes off the ulna and across here like that. So if you pop it up, you can see the tendon coming across here. That's your extends your index finger. Extensor carpi ulnaris comes down here and extends the carpals here at the wrist joint, so extends the wrist along the ulnar side. Then you have abductor pollicus longus, which abducts the pollex or the thumb like that. So it's coming out here like that. And your extensor pollicus longus and brevis. So with those, I think that's the Quervain syndrome. If you do the Finkelstein's test, which is an orthopedic test for this, put the thumb in here, wrap the fingers around it, push down like that, and you'll get pain in here. That's tenosynovitis, which is like inflammation of the synovium within the tendon sheaths for these last three. Okay, so that's the radial nerve. Now we're on to the median. What colour have we left? We'll go blue for this, all right? So median nerve, and we go cutaneous. Okay, so cutaneous, and the cutaneous supply for the median nerve would be the ventral and lateral surface of the palm here like that, and the digits, okay, and the dorsal aspect of the phalanges here like that. Okay, so that's the median, and that's if someone has carpal tunnel, that's the area that will be affected. So the palm of the hand here, so really the lateral 2/3 of the hand here on the palmar aspect, and it will also maybe include the fourth digit here like that, and the distal phalanges of the first, second, third, maybe half of the fourth digit as well. But that's what it will affect when you've got that carpal tunnel. So you've got like 10 tendons that travel through, and lots of nerves that travel through. Your median nerve travels through here. Any of the structures in there get osteoarthritis or wear and tear or swell, and it affects the median nerve. Then you get tingling and pins and needles, and you get those carpal tunnel syndrome symptoms, and that can affect that, and that's the distribution that will be affected. Okay, so that's the cutaneous. We're talking about the palmar, which would be the ventral, ventral, lateral 2/3 hand and digits, right? And digits, and the dorsal phalanges, dorsal phalanges of 3.5 digits. Okay, so that's your cutaneous, and then we go motor over here. We go motor here, okay? And this is another one that has a lot of stuff going on. That should be plenty of space for it. So that should be plenty of space for it. So the motor branch is a lot of the flexor compartment of the hand in this case, but it's also got the pronator teres and the pronator quadratus. Pronation is the opposite to supination. This is pronation like that, so it will turn the hand over like this. So that's pronator, the pronation like that. So pronator teres will come across the arm from the medial side of the humerus like that, across here onto the radius, and it will turn the hand into pronation. And the pronator quadratus is a thick little muscle that runs again from the ulna to the radius on the very distal aspect, and it'll turn the hand, it will aid in turning the hand over into pronation as well. Okay, so that's pronator teres. Pronator quadratus. Okay. Pronator quadratus, we've got the flexors, we're talking about the flexors of the forearm. So flexor carpi radialis, we'll keep going, flexor carpi radialis. We'll have the flexor digitorum superficialis and the flexor profundus. Digitorum. Flexor profundus. And that will be the radial half of the flexor profundus, which I'll explain in a moment. Flexor profundus. What else have we got there? We have the second and third lumbrical. They're the intrinsic muscles of the thumb. Okay, and then we've got the thenar muscles. Second and third lumbrical. And then we have the thenar muscles, okay? So, and the thenar muscles, that's your hypothenar eminence and that's your thenar eminence, okay? So, thenar muscles, okay? And how I remember those is O, F, A, okay? Opponens, pollicis, longus, flexor, pollicis, hold on a second, that's not longus, it's brevis. So, pollicis brevis, and it's all pollicis brevis, okay? Flexor, pollicis brevis, and abduction, abductor, pollicis brevis, okay? That's all the motor supply to the median nerve. So I've mentioned the pronator teres and pronator quadratus. Flexor carpi radialis is a flexor that comes down here onto the carpals here and it flexes the wrist. Flexor digitorum superficialis comes, it's a superficial flexor, so it comes down here and it goes not onto the phalanges but onto the metacarpal, your intermediate phalanges here, so it doesn't flex the very distal phalanges here like that, so it's involved in flexion of the wrist and fingers. And flexor profundus is flexor digitorum profundus is deeper, and that goes all the way to the distal phalanges, so that's involved in flexion of these at the top, the distal phalanges. Second and third lumbrical, so here and here, intrinsic muscles in the fingers here, and then the thenar muscles. Opponens pollicis brevis, so opponens is opposition, so opposition of the thumb to your second, third, fourth and fifth digit, like that, so that's really important. And flexor pollicis brevis, so it's a short muscle here that comes across there and flexes the thumb, so it attaches in here like that along where the carpal ligament is, in like that. And abductor pollicis brevis, okay, so that's back here like that, and it abducts the pollex like that. So that's the brachial plexus median nerve. And last, we'll go green again just to have a contrasting colour for you. And now ulnar nerve, and we're going down here, and we're going to have to drop down on one knee, and we're going cutaneous. We're nearly there, okay? So cutaneous branch of the ulnar nerve, all right? Cutaneous branch is basically what we have left, so it's the ventral and dorsal medial 1/3 of the hand. So it's basically here like that of the hand. So we're going to say ventral and dorsal medial 1/3 hand. Okay? Keep it all in blocks. Hand. Okay? And now just want to make that a bit tidier. Hand. And now we're on to last, okay? Motor branch. So there's not too much in this in compared to the median and radial nerve, which is loads. So stick with it. You're nearly there, and then you'll have the brachial plexus wrapped up. Okay. So the muscles here are adductor, pollicis, brevis. I'll explain. This is an interesting one actually, and I'll explain to you why it's an interesting one in a moment. And flexor carpi ulnaris, carpi ulnaris, and then again you've got the flexor digitorum profundus, which you mentioned here. And then outside of that, we've got again the hypothenar muscles, which are here. So the hypothenar muscles, okay. And the way I remember this, you see the OFA. So OFA. So again, it's opponens, right? Opponens, flexor, and abductor, abductor, and it's digiti minimi, okay? That's your pinky, small finger. So anyone who was stuck with me through this, well done. Try to make it interesting. Try not to be too bore you to death. But to me, this is a really interesting subject, because if you have an understanding of all this, it makes you better at diagnosis and better in the clinical setting. So jumping in, treating people without this knowledge, you're often wrong, and you'll often go and be misdirected in your treatment. Knowing this is really important. So that's your kind of motivation to learn it, okay, and to watch this. Minimi and abductor, digiti minimi. Okay, well done. Okay, now motor. I'm going to explain this. That's why is abductor pollicis brevis interesting. It's interesting because it's adductor pollicis brevis. That's adduction, right? And in here is the muscle that it feeds. And you'll find with somebody. With some people, they have wastage of this muscle where it's completely hollowed out. I've treated plenty of people like this, and if you didn't know this, the first thing you would think of that it was something to do with perhaps the radial nerve, because it's on the radial side, when in actual fact it's fed from the ulnar nerve. So it's a weird crossover here like that. And often it will be someone with what's called cubital tunnel syndrome, which is where your funny bone is in here, the cubital tunnel, where the ulnar nerve comes down here, but it feeds over to this muscle. And if it gets from osteoarthritis in here in the cubital tunnel, or osteophytes, or from a previous fracture, or something that is pressing on the ulnar nerve and not allowing it to innervate those muscles, you get a severe wastage here. And also, if that isn't the case, then you're looking up the chain and you're thinking, okay, it's the ulnar nerve, so you're thinking about about the lower portions of the plexus. So you're thinking about the contributions that would come from the C8 nerve and the T1 nerve, right? So that kind of will lead you into better diagnosis, so you have an idea where it is and if there's restriction in the neck, if it's facet joints in the neck, or if it's again stenosis in the neck or disc bulge, then you are better at diagnosis. Flexor carpi ulnaris flexes the carpal along the ulnar side here like that, the wrist. Flexor digitorum profundus, okay, and that is the ulnar half. Okay, the ulnar half. Okay, and to the right, yeah, the flexor profundus here. I should have wrote flexor digitorum profundus. The radial half up here. Radial half. Come on, Neil. Radial half. So that's the hypothenar muscles then. The opponent's digiti minimi. So that's your digiti minimi. Opposition here to the thumb like that. Flexor digiti minimi. And abductor digiti minimi, just pulling the little mini-me, the pinky out to in a medial direction from the anatomical position. Okay, well done for those who stuck with me for this, for both the part 1 and this part 2, all the branches of the brachial plexus, and all the cutaneous and motor nerve supply. If you like the video, you want me to do anything else on anything that will help you in your learning journey, let me know and I'll be happy to do it. That's what I'm here for. I hope you like the video. If you like the video, I'd appreciate if you subscribe and hit the notifications, and I'll talk to you next time. Thank you.